Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates. Again, rocking solo today. We've got two patients in this compilation and neither of them are mine. So the first one you see in here, this is Katie's removal. The second removal then is Rhys's. Both dry skin from what I could see before I opened it up just now. Katie's got this very, very solid, deep piece of wax here. This looks like it's been pushed in with something. Can't 100% say what that is, but Katie's trying to loosen some of this dead skin that's near the entrance, and that's a good thing to do here as well, because that, as that peels away, that sometimes loosens up those deeper sections as well, and it just generally tends to make it a lot easier. Look how thick that skin is there. So all that white you can see under there, that's the sort of newer or the fresher of the dead skin, you could say. So that now, that is usually a lot softer and it's a lot easier to get a grip of as well. So Katie's got the standard size ulnar tube here. That oil that we've just put in now, you can already see has seeped down to where that deeper, darker, solid plug was. Now, Katie's doing this little sort of wiggling motion. And the reason we tend to do that is with the oil, basically. And it also helps to slowly and carefully sort of peel that off the ear canal, which is what we need to do here. Because this, as you could see from when Katie first went in, was solid and it had no movement at all. So each of those little movements there now is going to allow a little bit more of that oil to seep underneath. I think Katie's popped a bit more in here. Yep. There we are. You can see the difference. You can see that's already starting to lift. So that's a lot more mobile now, but we just got to try and hold that suction grip. There we are, a little bit of a wiggle. And that is coming free. Done a really good job there, because I didn't think that was going to be quite as easy to take out. Really, really dark piece as well, which is normally a sign that's been there for a little while. That's been there for a good few years, that. Oh. We've got 1 centimetre there. Now this is Rhys's patient, and you can see we've got a very, very similar issue here. Pretty much fully occluded. This is completely chock-a-block in here, but very, very deep as well. This looks like it could potentially be right up against the eardrum. Now you'll already kind of see there's a bit of redness to the ear canal. Now I don't know myself, but this is sometimes a little sign that the patient could potentially be experiencing some eczema inside the ears, and this consistency of what Rhys is trying to remove here is quite typical of that. Yeah, you can see it. It's a very strange consistency, because it's almost really solid, but then as you start to break these little bits away, it almost kind of looks stretchy. It's a very difficult kind of consistency to remove. So I think what Rhys is doing here is he's trying to gently go sort of around the edges, just to try and loosen bits away. We've got a leading edge here now. We've got a little bit that's kind of poking through. So Rhys has got a set of forceps here now. I don't think that's all going to come out. No, it's broken a bit away. So this is it's going to be a painstaking removal, I think, this one. We've got another little edge there that Rhys is going to get a little grip of. It's just a little loose piece. So I think Rhys is going to try and reposition now some of those edges to try and get another grip with the forceps, possibly. Oh, no, that's a good grip. It's always difficult with this skin, because there's usually always pieces behind that are still attached to either the eardrum or the ear canal, and it just makes it really difficult to maneuver because you got to be careful, because again, it's a very sensitive area inside the ear canal. This is a portion of the ear canal which is just a layer of skin on bone. It's very, very sensitive. So even one little touch of the ear canal in this area almost kind of feels like a sudden pinch. It's a very sudden, sharp kind of pain you sometimes feel. It doesn't cause any damage, but that's how it's perceived. It's like a very short, sharp pinch. I only know because I've experienced it myself. It's not nice. It's not nice. There we are. We've got bigger pieces coming away now. Trying to drop that down from the top. It looks like there's quite a thick sort of layer in that top portion. And I think if Rhys can just drop that down a bit, you might get a good grip with the forceps on that piece. Yeah, you can see it's so dry. It's not really, there's no give to it. It's we can move it around slightly, but it's like kind of holding on to the ear canal. Oh, a little bit of a wiggle. It's slowly coming. It's slowly coming. It's almost like it's like a large piece of skin that's almost kind of been crumbled, like an empty packet of crisps. So you could just see, like, behind there, as Rhys started pulling that forwards, it started stretching, but it was still attached. Just got the forceps back here now. Yeah, trying to get a grip on that thicker piece that was at the top. Whoa. It's slowly unraveling. We get this question a lot with this type of removal, you know, and we say to the patient, you know, what we've removed, like, oh, this is a lot of skin, or, you know, there's a lot of wax there, you've got a bit of both. And we get it quite a lot. People say, what can I do to prevent it? I'm not trying to be negative, but there's not really a great deal you can do, because the ear just produces it naturally. So unfortunately, this is something that, you know, if it is a problem for yourself, the only advice really would be to get it seen on a regular basis. We get a lot of patients coming through that are coming every 3 months to have this done, which is very common. Unfortunately, you know, some people can't get away from it, especially if you've got really, really narrow ear canals. They fill up quicker. It doesn't take as much wax to block those ear canals up. So yeah, regular maintenance, regular visits, and you can use olive oil on a regular basis. Again, if somebody with my light's just turned off now, which is why I've gone a little bit dark, sorry. Somebody that has really narrow ear canals might not want to use oil, because you're just going to block your ears up quicker. So, I mean, oil is usually recommended to keep the wax and skin nice and soft, so that it's easier to remove. Look at that, piece has come away. But yeah, you know, regular oil, about once a month we usually suggest, but I mean, it's completely up to you. Yeah, you can see just how dry and crumbly those last little pieces that are left. So this is likely, looking at how this is in the patient's ear canal, this looks like it may be a regular issue with this patient. As in, I think this patient is quite likely to, you know, have this done every few months, possibly every 6 months. Because the skin, what we're removing here now, this is basically what's grown from the eardrum. So this is not wax that's been produced near the entrance of the ear and has gone further in. This is actually a skin, almost like a keratin, a really hard, like thick, dead skin that's just accumulated, possibly quite quickly over the surface of the eardrum. Now, Rhys has got a fine end on here now, which is the smaller of our suction tubes. There's only 2 sizes that we use, and this is the smaller. This is essentially an attachment that we use for our standard size. Yep, that little bit was flickering at the top there. I was just going to say he's going to remove that bit first. Ooh, oh, nice. I was going to say that was all tacked around the corner then, that darker piece. There we go. Ooh. Very fine work this, and you almost kind of got to have, I wouldn't say trust in the patient, but when especially if it's a first time patient who has never had wax removal before, they can sometimes get really nervous when you say you've got really deep wax that's almost, kind of going over the front of your eardrum. But as long as you're nice and still, which understandably, if it's your first time, it's very difficult to stay still when you've got this noise in the ear. You don't hear the noise on the videos because we've taken the noise off, but it's a suction, so it's like a wind noise. These pieces, you don't generally get any discomfort when we remove, even moving these pieces here, you don't generally get any discomfort. It's the sound that is what kind of annoys a lot of patients. And there's not a great deal we can do about that with the suction, unfortunately. Excellent. Wow. That last little bit is a bit of a gap there. Rhys has cheated on his ruler shot there. I would say there's probably about 6.5 centimeters roughly there. I have to go a bit closer. I haven't got my glasses on. 2.25 inches, or 2.5 inches actually, just over. I'm all over the shop with those. Anyway, Rhys is going to be back soon, guys. There's one more video you're going to see myself solo again, but me and Rhys will be back together very shortly. So give it a couple of days and he will be back on the next videos, guys. So take care of yourselves and we shall see you on the next video. Thank you very much. Bye, everyone.